I'm David Lasseter, the founder of and partner at Horizons Global Solutions, and we've been working with Recce now for a couple of years to develop the strategy and to execute this strategy, and working with the United States federal government, and specifically right now with the Department of Defense, or Department of War. My previous experiences, most recently with the United States government, is serving as the Deputy Assistant Secretary of Defense for countering weapons of mass destruction. And in that role, I oversaw all programs, policies, and strategies related to CBRN defense, both internationally and working with U.S. government interagency partners. And one of the major issues that I oversee was the biological threat response and spectrum. And what Recce 327 is doing is exactly what the Department of Defense, Department of War are seeking. Ryan?
Thanks, David. And Ryan Kane, Managing Director of RK Strategies. RK Strategies is a healthcare, life sciences, and preparedness lobbying consulting firm helping biodefense companies, public health companies navigate the U.S. government. Simultaneously, I also serve as the vice president of a leading biodefense company and previously worked for several United States senators, members of Congress, mostly in political, but also policy capacities, and eventually turned to the private sector. David and I have been working together very closely to help develop Recce's U.S. government programs, and we're excited to share more with you today about that. Next slide,
Next
please.
slide. And as we've been working together, most of it is focused on ensuring that what Recce is doing is answering the call of the United States government, and in this case, for the Department of Defense and the warfighter. And when we talk about providing the best capabilities, we also talk about doing this at the point of care, doing this on the battlefield to provide a capability to as quickly as possible to the warfighter, that being either, again, on the battlefield or at the closest level of care. This is both for antimicrobials, but also, and probably most importantly, in a lot of the research that Recce is undertaking now with the United States government, that is in burned and blast wounds as well as combat wounds. And so this is a very important area that the department wants to continue to try to get a hold on. Ryan, other thoughts?
Thanks, David. Other areas the government's looking very closely at, of course, is antimicrobials, which continues to pose a significant challenge. We've seen that out in the field, for instance, in Ukraine, Israel, and other areas in the theater where there is significant infection on the battlefield, and current antimicrobial candidates are not able to support those wounds. And so all that to say, the U.S. government has looked very closely at R327 and has supported it through several programs, in large part because of its broad utility as a new antimicrobial candidate that also addresses the burn and blast areas, combat wound infections, and of course, biodefense threats. I would also point out that the U.S. government has moved towards the adoption of pathogen agnostic approaches. Think of drugs that can treat multiple bugs versus the old model, which was one drug to treat one bug. And that model's failed in the U.S. government. And so they've moved to look at rapid treatment options that can treat a wide array of threats, including threats that are unknown, that are easy to scale and shelf stable, and this sort of thing. And R327 really fits the bill nicely. Next slide, please.
And as we discussed a little bit previously, the challenges for the United States military are quite significant in this area. We want to be able to save the limbs, to stave off infection, to provide a countermeasure as quickly as possible, because it will the department would then have a better chance of, again, providing the best solution to those wounds, and then preventing the potential loss of limb, and even more than that, life. And so most of these are multiple potent bacteria. So something like R327 has the ability, as we've seen, to kill all of it, and that's absolutely essential because it enables that application to be applied to any wound in any climate and place, which is something the Department of War obviously seeks routinely, as a global environment for potential operations. Uh, Included this would be, obviously relief for pain that the warfighter might experience, and to promote essential wound healing. And I know, Ryan, we talk about antimicrobial resistance being, only growing and growing as the years go out, and such a capability as 327 will provide the right solution for the United States government. And in this case, we've discussed the U.S. warfighter and our allies. Over to you.
Thanks, David. And the other area I would add is that there's broad application as well within the biological threats. These are category A and B agents, agents that are incredibly deadly and that are significant concerns. Adversaries to the United States and to our allies are actively developing some of these agents today, and the U.S. government is looking to develop medical countermeasures that may treat it. And R327 really fits the bill nicely. And as we'll talk about in a future slide, the compound's been tested and is in testing against a number of these category A and B agents. Meanwhile, it's also highly efficacious against more of the common infections. And so across a variety of formats, a gel, a hydrogel, a number of other formats as well, such as IV, where there's a lot of different routes of administration to treat a lot of different infections, and that really drives the utility of this compound. Next slide.
Yeah, and we're really excited. We've been working on three areas in particular with the U.S. Department of War. The first is the congressionally directed medical research program, and it's an annual program that the United States Congress funds specific areas for the Department of Defense, Department of War, to research and provide capabilities, medical countermeasures, and other research to the department. And it's a it's a really important program. In this particular opportunity that Recce was selected for, is providing a synthetic anti-infective, as we've talked about, R327, for treatment of burn wounds and the downstream impact. And this has allowed for the work and development of this room temperature stable 327 hydrogel dressing in sachets for field use. And this will allow the treatment on burn wound infections, and the current work is on animal models, and it's showing some success. And it's been great to see thus far, and I know the department is eager to continue this work with Recce. Ryan?
And that award, the CDMRP, is a highly competitive award. In fact, it's one of your most competitive grants that a company can receive. And so it's especially notable that Recce, an Australian company, was able to win this award. To win this award involves a very significant amount of vetting at the highest levels of thought leadership in the infectious disease space. And Recce was able to come out on the top and secure that. And that was a several million-dollar contract that supported this program and continues to this day. Additionally, there are two other programs that are underway, both CRADAs, which is cooperative research agreements, research and development agreements. The first one with the U.S. Army, U.S. AMRID, which is the U.S. Army Infectious Disease Institute, and that's looking at a number of the category A and B indications that I mentioned on the prior slide: Burkholderia, Yersinia pestis, Pseudomonas, this sort of thing. Some of the worst pathogens that are causing the most problems or of the most concern to the U.S. government. And this testing is well underway today in a U.S. government laboratory. And that program is funded today through the Defense Threat Reduction Agency support into that U.S. Armored Lab. The other program is at the U.S. Army Institute of Surgical Research, looking at reducing the bioburden of Pseudomonas and burn wounds. And that's yet another extension of the ongoing U.S. government efforts. And all this to say, with the two CRADAs and then, of course, the grant, it just underscores the promise of R327 in the eyes of the U.S. government. They're really excited about it because it's fitting the need of the U.S. government and continue to invest in it. And we would expect to see more in the future, given the wonderful capability that this compound brings. Over to you, David.
Yeah, I think you nailed it there, Ryan, at the end that these three opportunities are, in our experience and our knowledge, are likely to lead to other bigger and even better opportunities with the United States government, which we're excited about. And there are even a couple of opportunities this year that we're already surveying, and we believe there's a high likelihood of success that Recce 327 could be very competitive to winning some of these even larger awards. And so we're looking forward to that work. We know this is a many-year effort, and it's going to pan out to be quite incredibly capable for the United States warfighter, and as we talked about, our partners and allies as well. Thank you.
Thank you all.